Good evening, ladies and gentlemen, and welcome to OPA. This is Master Coordinator Terry Coakley and
Joanne Nistico. Thank you all so much for joining us this evening for our December OPA call, and welcome to guests who are coming in to hear this great speaker today, because it's an exciting call on taking care of our animals. And we have Pat Lacy, who will be our speaker. She has 61 years of experience as a dog trainer and as a director of Therapy Dogs and Associates. And we decided to host this evening. It's the last call for OPA, Shackley OPA in 2017, and we wanted to make sure that it was fun and special, and we all know how special our pets are to us. So we welcome our guests who also are pet lovers. Shackley products are proven to work in humans. We all know that on the call. And as we are about to learn, pets as well. Although Shackley does not test on any animals, praise the Lord, we have a dog specialist who has worked miracles using these products to save dogs' lives. And we want to welcome to the stage the dog lady, Pat Lacy. Thank you, Pat. You're a marvelous lady. We heard you speak at one of our conferences not too long ago, and we liked it so much we thought we'd like to have you speak to the rest of our OPA and Shackley group and other guests and friends of ours. Consults with Pat. She does consultations. We'll always go away beyond learning about herbal remedies and nutritional remedies to include in the importance of taking care of your pet, but also how harmful cleaners affect our animals that we may be having in our home. And as we know, our pets are worth looking into, making sure we give them the best home environment and life possible. So Pat, welcome, and thank you very much for being our guest speaker.
Thank you for having me, Joanne. I appreciate it. I hope we have some folks that are interested in helping with their pets to have a healthier life. And I'm sure some of you out there have already been doing some of this and perhaps have some stories to tell. We have a lot of things to remember with our animals is that they can't talk to us. I talk with the veterinarian, and sometimes we just would wish they could tell us what's going on and what hurts and what's causing them problems. And I told him, I said, if they could just talk 15 minutes a week, he said, I'll take it. So it's really hard for your veterinarian to really know what everything is going on with your dog, because when you go to the doctor, you can talk to them. When you take your pet to the doctor, they really have to work through a guessing game, a process of elimination, blood tests, x-rays, etc. So we hope we can help them with some prevention so they don't get into trouble. We have some pictures of some of the dogs that I've worked with, and the one that's up here now that is the darker poodle. I had poodles for 43 years, so they're prone to a lot of stomach problems and skin problems and things like that, but I've enjoyed having them. And the dark poodle is Fifi, and she was my first poodle, and that was many years ago when I got her, and did not know anything about natural foods. I'm in the Richmond area, and there were no foods in the Richmond area that did not have chemical preservatives. And as I began to learn, I'm a dog trainer, and as I try to teach my students with their dogs, I try to keep up on things that are keeping the dogs healthy. And when I started investigating food things, food allergies and food concerns with the dogs, I found out that there was a strong ethoxyquin preservative that was being used, and it was being used in every dog food in the Richmond area. I went to the pet stores, I went to the veterinary food, I went to the kennel foods, and every single one had ethoxyquin as a preservative. So I found out some things about food that I could order, and they were in California, and so I had to have food shipped in to get a natural, non-preservative food. That was the beginning with Fifi, to learn to try to give her a better food to prevent some of the allergies that she had in itching. So that was before I'd met Shackley, but I started that with a food change with her. and she was a very active and energetic dog until she died at 16. The next poodle was Blue, which is the white poodle up there, and he had a lot of skin allergies. White dogs are prone to some skin problems, and he did have a lot of skin allergies. His chest would turn really red, his hair would drop out, and you can see from the picture I kept him in a very long coat. But he would have bare spots where he was losing his hair. And we couldn't do anything but some strong medications, prednisone and that sort of thing with the vet. And I didn't like putting all those kind of chemicals in his body. I went to a dermatologist in Maryland, and she said she needed to check what kind of cleaning products I was using. And she said Bounce, Lysol, Pine Sol caused a lot of skin problems, skin allergies, and ulcerations under the eyelids. Well, when we got the Bounce out of our life, Blue began to grow his coat back and had no more allergies with the skin problems. He also had some eye issues, and I believe that probably came from some of these products also. Those things got much better after we had cleaned out the chemicals in the cleaning products in our house. You want to be careful to go through your house and see that you're not using any of the strong chemicals. Remember that your dog is on the floor most of the time, and especially your little ones. They're closer to the linoleum, to the tiles. They're closer to the carpet. So if you're using carpet cleaners or cleaners for the floor that have strong chemicals in it, that's really close to them where they're laying on it or they're breathing it or getting their noses down or licking the floor. So you want to consider something like Get Clean that is very easy to use to clean and doesn't have any of those strong chemicals to affect your dog. He had a breathing problem at one point and had to stay at the vet and was on oxygen. I took him off of all of the dog foods at that time and put him on a home-cooked diet, and he recovered completely from that. This is where I learned about Shackley, right about here, and found out that I could use alfalfa for the skin and for his breathing, and began to use the vitamin E and the vitamin C to boost his system there. He was very energetic and an active therapy dog until he died at 14 and a half. Fella was the next one on the list, and he is also a miniature poodle. Fella had symptoms that were not identified, throat issues and eye and nose drainage, and he had a lot of problems with that we couldn't identify. None of the testing, none of the blood work really showed us what it was. And I began to use Nutrifuron, vitamin C, vitamin E, and Liquil-E, and that began to help control the issues that he was having with the drainage in his eye and his nose. As he got older and began to have a little bit of weakness in his back legs, I used the joint complex. All of this really helped him to be stronger and helped his immune system. And he was on natural food, and of course we were using the Get Clean with him. He was very active therapy dog until he died at age 17. Misty, on the top line there, was also a miniature poodle. She had skin testing that showed she was allergic to everything. I thought I was going to have to put her in a bubble. She was allergic to environment. She was allergic to cloth. She was allergic to latex. She was allergic to foods. So there were lots of things that she had problems with. She was diagnosed at 15 with a kidney failure after just a routine blood work. She was extremely active. She was showing no symptoms. I had the blood work done 3 times because I couldn't believe it, because you look at the dog and she was just very happy, very active. I finally took her to a veterinarian that used natural solutions, and she gave me a special home-cooked diet. I took her off of everything except this particular diet. I used the alfalfa, the vitamin C, the vitamin E, the Liquil-E, and in a few weeks, her blood work turned back completely normal. She did not have kidney failure. She was a very energetic little dog and very happy, and she was a very active therapy dog until she died at 17 also. Poppy is the one in the top, and he's a Coton de Tulier, and he had limping on one back leg. He was very active, and he jumped and bounced, and he is a short-legged, long-bodied dog, and probably 10 inches at the shoulder, about that. So he's not very tall. And I have a 4-foot fence, and he could jump up and look over that fence straight up with all 4 feet going straight up, not standing on his rear feet, but going straight up on all 4 feet. So he did a lot of bouncing and jumping. As a result, he did have some limping on one back leg, and he had some shoulder pain and some limping on the front leg. I used the joint complex on him, and that took the limping away for him too. He was very active, but at 13, he was diagnosed with a mast cell tumor under his right eye. And they did surgery for that, and that worked out to be very well. He was very successful with that one. A few months later, he developed a mast cell tumor on the edge of the rectum. I refused the surgery on that because I thought that it might cause him to have incontinence, and he had no symptoms whatsoever at that point. He was happy-go-lucky and active and eating and playing and everything. So I was afraid that that would cause him to be incontinent. I used the Nutrifuron, the vitamin C, the vitamin E, the joint complex, the Vitameg, and did not use any of the chemo or radiation on him. He managed a very active life for about 2 years, developed stomach symptoms and not wanting to eat later. And when I went to the vet, he had an ultrasound. And the ultrasound showed that he had gotten another mass tumor, and it was a mast cell tumor, they guessed, but it was inoperable. He lived a very active life until he was 15. The doctor said that I had probably gotten a longer and a better quality of life than if I had used the chemo or radiation. He was very pleased with the results that we'd gotten on the natural supplements. All of my vets work with me on working with that, so you have to also check with your vet to be sure that they're willing to work with you on using natural supplements, but most of them will if you're talking with them about it. Angel is the one on the bottom, and she's a Bichon, little rescue that we got, and at age 10, she was limping on both rear legs, and the medications were not working for her. They were not giving her any relief from the pain. An evaluation recommended surgery on both rear knees. That's pretty invasive. That's pretty tough. I decided to delay the surgery and pin her in a small X-pin, and I used the joint complex and the Nutrifuron, the vitamin C and the vitamin E with limited exercise. And after a few weeks of that and keeping her from over-exercising, she began to walk on her legs again. She had no surgery, and today she runs like a puppy, and she's 13 and a half. Grace was, all of these dogs that I've talked about so far are my dogs. Grace is a Papillon, and she was 4.5 pounds, and she was a student's dog. And she really had a really rough time. At age 9, she was diagnosed with Addison's disease, placed on a ton of medicine. She had a schedule. I kept her when they went out of town. And she was on medicine in the morning and mid-morning, lunchtime, mid-afternoon, evening, and bedtime. She had a regular look like a hospital set up for her. She had hot spots, swelling of her stomach, enlarged spleen, gallbladder, and liver, all enlarged. She got mange, and I recommended to the owner that she give her Nutrifuron to improve her immune system because she had so much going on. Grace is the Papillon. She's the brown and white dog, I think, in the previous picture. If we could back that one up. Yes, the one in the upper left-hand corner. Yes, that's Grace. And After we started the Nutrifuron and the joint complex, the swelling was reduced, the mange cleared up, her coat grew back. After a few months of this regimen, her blood work was almost normal for the first time in 2 years. Most dogs only live about 2 years or less with Addison's. She lived 3.5 years and was very energetic and was also a very active therapy dog till she died at 13. Kinley is the hound on the side there, and she's a Basset Beagle, and she had an undiagnosed allergic reaction to something that was causing diarrhea, vomiting, weakness, and requiring an IVs and an ER treatment. 2 years consecutively she was in the ER with this. And I recommended that they start her on Nutrifuron to build up her immune system to be able to fight whatever that is. They did that, and there was no more attacks, and she's still active at age 7. So that built her immune system up, and she's doing great. Charlie is the next picture down. If we can go to the next one. And Charlie's in the upper left-hand corner, a little cream-colored Shih Tzu. And he's a student's dog. And I keep him when he goes out of town. And little Charlie came to me limping on both back legs, and he couldn't go up and down steps. We had to pick him up and carry him. Even though I don't have a lot of steps, we still had to carry him. I recommended putting him on the joint complex, and I did, and gradually we began to see him be able to walk and even go up and down the 2 or 3 steps at my house. And at the end of the 10 days, he was not limping at all. He's still on a maintenance dose of joint complex, and he's very active at 11.5, no more limping problems. The one in the right corner is Maggie. She's a Snoodle, Schnauzer, Poodle cross, and she is on a maintenance program of Nutrifuron, vitamin C, and joint complex. At 10.5, she has no health issues, and she's an extremely active, energetic dog, and she's a very active therapy dog, visiting the nursing homes and hospitals now. When you're choosing food for your dog, you need to consider choosing natural foods, whole food supplements, chemical-free cleaning products like Get Clean, and that helps to improve or prevent health problems for ourselves as well as our family pets. Good health depends on good health choices. If you have questions, you can let me know. I appreciate talking to you today.
Pat, thank you. We do have time for questions. That was very quick. Tell us a little bit about your therapy work. How many dogs do you have, and how many? What kind of therapy do you work with specifically?
We go to nursing homes, hospitals, children's groups. We go to schools and talk with the classes. The dogs have to go through several weeks of obedience training in order to be evaluated, and the owners are evaluated also for handling skills to be able to be members of Therapy Dogs and Associates is my group. And it's the oldest group in Richmond, being 34 years old this coming March. And we have a variety of kinds of dogs. The picture that this is of me sitting there is cropped out of a group picture that we had. And we have about 25 dogs that are active in our group. And we have everything from an Irish Wolfhound, who's about 110 pounds, down to the little 4-pound Papillon. She has a new Papillon now, and she's about 4.5 pounds. And
Pat, we have one question that came in, and you can write your questions in the question box. And I'll just mention one thing. My daughter, who has an adopted dog, and it's it looks like a miniature Doberman. And my daughter called me the other day and said, Ari's had terrible diarrhea during the night and was very uncomfortable and whining. And I had her, and Ari definitely has a very sensitive stomach, so I will be talking with her. And she does buy specialty food because of different allergies. And she asked me, Mom, what Shackley nutrition should I give Ari? and I mentioned the Optiflora Pearls. Now, she's a small miniature Doberman size, so I said, well, give her 1 pearl a week. What kind of, how often do you think the pearls might be utilized for that size and a dog of that nature?
Do you know how much she weighs?
Oh, gosh, no. She probably weighs about 20, 25 pounds.
Oh, 25 pounds. I'd give her a whole one probably daily.
Okay. Well,
I don't think that would be any problem with a 25-pound dog. You might want to not do it daily if you're talking about the 4 or 5-pounders. It's a little teeny.
Yeah, no, more than that.
Yeah.
What
it sounds like you're talking about might be something like a min pin.
Yeah.
They look like miniature Doberman. But that size dog can handle, I think, the whole one at least once every day or once every other day.
All right, I'll mention that to her. Here's a guest who's asked, what size of doses for things like Nutriferin and joint health?
Depends on the size and weight and age of the dog.
Okay, my dogs are 40 pounds and 70 pounds.
Okay. And what was the ones that you wanted to talk about? Nutriferin and what?
And joint health. Also, have you tried the new Recover product? Because I find that Recover product's very good for pain.
All right. I have just started that myself, Joanne. I fell 3 weeks ago and injured my knee, and I have an old injury on my left ankle, and so I activated that. And I went to the doctor. I had nothing broken, so I started the recovery along with the joint complex and also along with the pain complex. And I had to walk on a cane for a week, and now I'm not using the cane, and I'm not having any severe pain now at all. It's very little pain now. And I just started that recovery probably less than a week ago. And I really do feel like I've made a difference with the recovery.
Yeah, it's a great product.
I have not used that on the dogs. I have not tried that on the dogs yet.
Okay, well, let's
40
see.
pounds and 70 pounds, I would probably give them a whole tablet.
A whole tablet. Just follow
the complex.
Follow the directions on the labels as you would normally.
Well, Angel is the one that I used it for the limping. Angel is about 13 to 14 pounds, and I'll give her a half.
Okay. All right. Now, here's another question. How do you give the supplements? A good question.
I squash them up in the pill crusher, and I put it in yogurt. If you're giving canned food, you can mix it in that. I use it in mine, get yogurt every day, and you can mix it up in anything that you're doing that might be wet or a little bit liquid just to pick in the powder. If your dog if your dog doesn't have any problem with pills, you can put it in peanut butter.
Okay, here's the other question, which I think we discussed a little bit. And then, Scott, maybe we can open up the lines because people may want to ask a question. Do you use the probiotics on your dogs? I know we do, but
I have not used it on a regular basis. I've used it a little bit, but I have not used it on a regular basis. I am beginning to start Angel on that now because she has just had some stomach issues, and they recommended using one that they have at the vet. So I'm going to use ours. But I haven't gotten her. I don't have enough experience with that to tell you anything yet.
Okay, well, I know
I'm just beginning.
Yeah, we have used it successfully.
Good.
And it does work. They're really, again, I know when I wrote you a question about a German Shepherd, someone had asked me about, and a lot of, we don't prescribe, we're just Shaklee representatives who have found that the Shaklee supplements have worked for us to help us feel better, live a longer and healthier life, and we're not prescribing anything for anyone or any dog or animal. However, we do have recommendations of things that have worked with our animals. There may be people on the call here who have used supplements for their dogs, and we can open up the line and see if anybody would like to share a story or ask a question.
Joanne, I always recommend with my students that they have the vet check the dog to be sure we're not missing a medical problem, because sometimes there is a medical need that they do need to use medication. But when they can just make the dog more comfortable and use something natural without having to use a lot of medicine, then that's always a plus if we can do it. But they need to check with their own vets first.
And
Exactly.
that goes right into this note that came in from Kim before I open the line. She's saying that her older dog, 70 pounds, is 16 now. She had a condition where her nails fall off and then grow back. Consulting with her vet, the vet and Kim have her on Omega Guard, GLA, vitamin E. The nails are much better, and they've never had to put her on the nasty meds that most vets prescribe, quote unquote.
Excellent.
Great story. Let's keep bringing those stories in because you may be helping a needy dog out there.
Okay, let me open the lines. If you have background noise, please mute yourself.
Hey, Pat, this is Pam Budner. Can you hear me?
Hi.
Hi. I have a 80-pound, 6-year-old golden retriever who has a very sensitive stomach. He's always had a very clean diet. He has very low food drive, unlike most other Goldens. But he has a tendency to get this condition where his stomach gets irritated, and the vet always prescribes Pepsin, something like that to help him. What product do we have that might? And I've just started putting 2,000 milligrams of fish oil in his food every day, our fish oil product. What else do you think might be helpful with a dog with kind of a sensitive gut that has a tendency to need antacids?
I think the Optiflora is going to be a good one for that.
Stomach complex.
I'm sorry?
Stomach soothing complex. That was the other I used for Ari, who had an upset stomach, just like people.
Mm-hmm. The stomach soothing complex is another good one. You want to be sure that the vet's checked, and you can tell a lot of this with blood work, as to whether the stomach issue is coming from anything to do with pancreatitis.
Right.
If it's pancreatitis, then you want to lower the fat level.
Right.
You want to have a lower fat food. So you might need to check your food to be sure you're not having an extremely high fat food.
Right. Thank you.
Mm-hmm. You're welcome.
Here's someone that asks, what would you suggest for a shepherd who has diabetes and recently started insulin shots?
I have not had any experience with diabetic dogs. I have students who've had them, but I've not been involved in what they're doing. I know that they need the proper protein, and I would imagine that the Optiflora would be another good one for them, too, that they are getting the proper balance of digestion in the foods that they do eat. I have not had a diabetic dog.
No, I had a woman here at the farm not too long ago, and she said to me, she had been on insulin, and she said that she had started on the Shaklee Life Shake, and dogs can use the Life Shake, correct, Pat? Have you?
Yes, that's the protein. Yes, that would be the protein I'm talking about. That could be mixed in something.
And then she, do you ever recommend like the Vital E? But this woman got on the Vitalizer and got on the protein, and when she went to her doctors, the doctor said to her, "What have you been doing?" And she got scared. She thought she'd been doing something wrong, so she said, "I haven't been doing anything." And he goes, "Well, you don't need insulin anymore. Your insulin levels are fine." And she goes, "Oh, I know what I've been doing."
Yeah.
She didn't want to tell him she'd been taking
improved her memory.
exactly protein and Vitalizer, and she is now insulin-free.
Yes.
So good nutrition always, and of course you have to see whether or not the absorption is going in to the body to get the kind of results. And always start slowly. You never want to change an animal's diet. You keep them on whatever medications the vets say they should be on, but adding a good source of protein and the Vitally, or even like Pam was adding the Omega Guard to her dog. We added stomach soothing complex and Optiflora to our dog that had stomach issues, and that helped resolve it. And again, it's always trying to see if we can treat it naturally. And
I
of course,
also found that the Liquily was easy to give.
That's great. That's a great suggestion. And there's Citra Boost too.
I haven't used that one either. Citra Boost.
Okay. Anyone else have some stories they would like to share with us, or questions? Pat, would you like to continue talking and add anything? We have more time as we're waiting. If anyone has any questions?
Well, I have a comment.
Okay.
We had Pembroke Welsh, and he was born with hip dysplasia, so he had some joint problems, and so we gave him alfalfa and the EPA, and he loved him so much. Whenever we'd get the bottle out, he'd stand there waiting for his. So all dogs aren't difficult to get to take these products. I just thought I would mention that. You don't have to hide it for all dogs. He just loved it.
That's good. I've got one of those. She takes anything I give her because she'd eat anything that eat her first. So we have to be careful what's around that she can. She had to definitely learn the lesson of not touching food without permission. Food refusal was a big thing for her to learn. When you're looking for food, you want to. A couple of things that I'll recommend is that you check for a food that has natural preservatives and not something that is using chemical preservatives. You want to also check with the ingredient level that the first thing in the food, just like food for us, the first thing in the ingredient level is going to be, should be your protein, your meat. I do not like to use byproducts. I don't find that they're a quality type of protein. I don't like for them to have colors and dyes, and you need to be careful that they are processed in the United States, that the sourcing is coming from the United States. We have had a lot of problem with foods that were coming in from other countries that do not have the same regulations on chemicals that we have. And so you want to be careful with that. Finding a store or a food source where you can get maybe some online areas too, that you can go in and talk to somebody that's knowledgeable about healthy foods that you can choose. And that includes your treats, as well as the rawhides and dental-type chews that you might find. Be sure where they're coming from and where they're made and what's in them, what are the ingredients in them, not just that the dog likes them. Sometimes we want to give them what they like, but that's not always the healthiest choice.
What about these rawhide things that you see, especially now in the holidays and Christmas? You see these rawhide candy cane treats. I know my husband said, "Oh, look at that." And I said, "What? They're not healthy for the dog."
That's right.
Is that true?
You're exactly right. Most of those are processed out of the country, and some of them even have formaldehyde as a preservative on it. And some of those that have, if you ever give the dog a rawhide and he chews it and it gets kind of gooey and it sticks to the fur, it gets down in his fur, it sticks to your carpet, sticks to the carpet, that is because it's covered up in a preservative on the outside of it. What they're trying to do is make that have a longer shelf life. And because of the longer shelf life, they have to use chemicals on it. And that makes the dog sick many times and can get, even if it doesn't make him sick today when he eats it, he's ingesting a chemical that's in his body and it becomes a toxin that later on builds up with other toxins until it does make him sick.
And to take a little bit on the cleaner side, what cleaners we use. And I know I have a barn here I have a kennel for dogs. We've got 3 dogs and 2 cats and 3 horses. And, of course, using Basic Age, which is a very safe product for people who are on the call who may not be familiar with our cleaning products. We have a vegetable-based cleaner that is pH balanced. and doesn't harm any living tissue cell, and it's very safe to clean around, your dogs, or to wash your dogs, bathe your dogs with, and it's very safe and easy to rinse. In addition, Basic G, Pat, you must love Basic G for...
Love that one.
Okay, and
yes.
So do you recommend it for your dog owners to use Basic G in the cleaning
Absolutely.
of their...
When you need to germicide something, Basic G is even effective on parvo. That's in some of our writings, and these are things that we deal with the dogs, but there are different things that we get in staph infections, and we get all kinds of infections from things that they lay on, and dogs don't know that there's rust on the fence, and they don't know that there are chemicals and things in the different plants and things like that. So sometimes they get into things, and you need to disinfect some things. Well, this is something that you can use on a cloth or something to sort of wipe down those areas that you need to disinfect with. And Basic G is very good. I really like it. And Basic H is one that you can actually, I've had a lot of students be able to spray that on a cloth and wipe the dog down with it. When he comes in the house and he's been outside and rolled in the ground or rolled in the leaves, that's a quick way to just sort of clean him up a little bit.
And very economical.
Yes.
Of course, use Basic G, and that's especially now when we have colds and flus around, to wipe down around the house. But I clean horse buckets with the Basic G to make sure that nothing is getting contaminated. I found that what really interesting was that you were able to clear up mange, because I know what a difficult disease that is on a dog. That's
one of the things with mange is that your immune system is failing. It's not helping your body, and so the Nutrifuron picked that right up to build up her immune system. Then she was able to fight that.
That's great. And so Nutrifuron, you're very big on that.
Oh, yes. Yes.
For your dogs and keeping them healthy. Of course, we all use it and regularly. A person asked, is it problem to combine Basic H with Basic G to clean with? It's not necessary, and we don't recommend it. You don't need to. Basic G is a cleaner. It does clean as well as disinfect, so you really don't need the Basic H with the Basic G. You don't want to... Go ahead.
I was going to say I use it when I'm washing the dog beds and their mats and their little cuddle beds and things. The Basic G helps to disinfect and clean their little mats and beds.
Definitely. And you can even, if you want to clean out their bowls, and of course you have to especially rinse Basic G to make sure that you have a good rinse cycle with the Basic G, whereas Basic H is, pretty easy rinse area, and no problem with safety or contact the skin. All right, does anyone have any other questions? Pat, you want to add anything?
No, I've enjoyed talking to people, and I can be contacted. I think my information was on there, and I can be contacted if somebody didn't get to talk and would like to, or has a question that they think up later. Be happy to try to see if I can help them out. I think my email is on there, so they could send me information about what's going on if they have a question. I'd be happy to try to see what I can do to help them.
Yes, and if you have an interest in having a therapy dog and being a part of that community, that would be a wonderful way to help other people, just as we help so many people in Shackley. That's another great helping hand to people who are in the hospital or who are in nursing homes. To see a pet, I always like to say, dog is God spelled backwards, and we all know how loving and faithful they are, so it's always great to be able to share that with other people. Well, thank you, Pat, so much for being our end-of-the-year speaker for OPA. I thought, what better call to do than talk about man's best friend? And as we are all friends here in Shackley together as an OPA family, we want to wish you all happy holidays and a Merry Christmas.
Merry Christmas, everybody.
Merry Christmas, and thank you for having me.
Thank you.
Thank you.
Thank you, Scott. Night, everybody.
Good night.
Bye-bye.
Good night.
Good night.
Bye.